Hello physios. So today we are going to study about a bone called humerus. Humerus is an upper limb bone which is present in the arm of the human body. Arm, you can know this part is called as arm. So this bone, arm bone, is called as humerus. So we'll talk about the detailed anatomy. So we'll start with the introduction. First, it is the longest bone of upper limb and it has three parts: upper end, shaft and lower end. So in the upper end, we will talk about the parts. First, the upper end has a head. It has head which is medially backward and upward and articulates with the glenoid cavity of the scapula to form the shoulder joint. As you can see, this is a shoulder joint. So the upper end of the humerus articulates with the glenoid cavity of the scapula, which we have learned in the previous lectures. So it forms a shoulder joint. The next part is the line separating the head and the rest of the upper end is called as anatomical neck. The third part is lesser tubercle. Lesser tubercle is an elevation from which the upper aspect of the humerus bone. Fourth part is greater tubercle, which is an elevation which forms at the lateral end of the upper end of the humerus. Then comes the intertubercular sulcus. Sulcus is the line or separating between the greater tubercle and the lesser tubercle. The fifth part is the surgical neck, which is the narrow line separating the upper end of the humerus from the shaft, is called as surgical neck. So we'll discuss all the parts in the diagram. As you can see, the upper end of the humerus, this part is the division between the head and the rest of the upper end is called as anatomical neck, and this circular portion is called as head. The elevation which is greater and present on the medial part is called as greater tubercle, and the elevation which is present on the lateral part is called lesser tubercle, and this groove or a depression between them is called as the intertubercular sulcus. Next come the surgical neck. If you divide this bone from here horizontally, it is called as surgical neck of the humerus. Next, we'll talk about the lower end of the humerus. Lower end of the humerus have two parts: articulating parts which articulates with the other part of the bone, and non-articulating parts which do not articulate with any part of the bone. Articulating part, it has two parts. First is capitulum and second is trochlea. As you can see, capitulum is a rounded projection which articulates with the head of the radius. This is the capitulum. It articulates with the head of the radius to form the elbow joint. The second part is trochlea, which is a pulley-like structure which articulates, which is a pulley-shaped structure, articulates with the medial edge of the ulna. Ulna's notch is present which articulates with the ulna, and this articulates with the radius and forms a elbow joint. Next come the non-articular parts of the humerus, in which we have medial epicondyle. Medial epicondyle usually projects on the medial side. Lateral epicondyle, which projects on the lateral side. Lateral supracondylar ridge, medial supracondylar ridge, coronoid fossa, radial fossa and olecranon fossa. We'll discuss all these parts in the diagram. As you can see, the lower end, this is coronoid fossa, this is radial fossa. Just above the capitulum, there is a radial fossa. Because capitulum articulates with the radius bone, so there is a radial fossa, means depression. And trochlear articulates with the ulnar notch, so there is the above fossa is called as coronoid fossa. This ridge is called as medial supracondylar ridge, and this condyle is called as medial epicondyle. And this above the lateral epicondyle, there is a ridge called as lateral supracondylar ridge. And when you go on the posterior view, you will see a olecranon fossa which articulates with the olecranon process. Now we'll talk about the shaft of the humerus. Shaft of the humerus has three borders and three surfaces. Borders, we have anterior border which is present on the anterior aspect, lateral border which is present on the lateral aspect, and medial border present on the medial aspect. We come on to the surface of the humerus bone. the anterior and lateral border forms the anterolateral surface, and the antero and medial surface, medial border forms anteromedial surface, and the posterior surface is formed by the medial and lateral border of the humerus bone. Now we learned about upper end, lower end and the shaft. Now we'll know how will you determine whether this bone is from the right side or the left side, means the side determination of the humerus bone. So there are few things which need to be remembered. First thing is upper end is rounded. Whenever you see a humerus bone, the upper end is rounded. The lower end is expanded from side to side, means it has many condyles or many processes. So the upper end and lower end you can easily differentiate. The head is directly posteriorly and medially upward, means it articulates with the glenoid cavity, so it goes from posteriorly and little medially. The lesser tubercle project in the front of the upper end and limited laterally in the intertubercular sulcus. So these points needs to be remembered for the side determination of humerus bone. As you can see, now overall we will revise the parts of the humerus. First is upper end. Upper end, as we discussed, it has anatomical neck, it has greater tubercle, it has lesser tubercle. The semicircular portion is the head. Then when you go in between the both the tubercle, there is an intertubercular sulcus. It is also called as bicipital grooves. Then if you cut the bone from here, this portion is called as surgical neck. This long elongated bone, long part is called as shaft of the bone, which has 3 border and 3 surface. The lower end is consist of first capitulum, which articulates with the radius, trochlea, it articulates with the ulna. Just above the capitulum there is a radial fossa, and just above the trochlea there is a coronoid fossa. And when you go on the posterior view, you will find the olecranon fossa also for the articulation of olecranon process. And the ridges, the medial, when you come to the lateral side, the lateral supracondylar ridge and forms the lateral epicondyle, and the medial supracondylar ridge forms the medial epicondyle. So this is a summary of all the parts of the humerus, and the rest, the muscles attachment and the clinical anatomy of the humerus, we will discuss in the next further part. Hope you like this session. Thank you for watching. Please like, share and subscribe.